Achoo! Oh, excuse me. My goodness. Oh, sorry about that. Hi, Dr. LeGrand Peterson here, and today we're going to talk about allergies because it's March and, it's that time of the season, the spring, where pollen is out and grass and the trees are growing and we start getting itchy eyes, start sneezing, itchy throat, and sometimes even rashes. So why don't we talk about allergies? And specifically, not just about allergies, but even food allergies versus food intolerances. There's a lot of confusion between food allergy versus food intolerances. And so we're going to talk about that. Let's first talk about allergies. Why do we get allergies and how do those present? So first off, there's antigens or an allergen that is first introduced to the body. And that usually could be peanuts, pollens, or grass. Lots of different allergies that can be presented to the body. And when it's presented first is what we call is an antigen presenting cell. When those antigens actually bind to the antigen presenting cell. Then the antigen presenting cell move into our immune system, going through the lymphatic system, and then presents to what we call as T cells once it's in the immune system. So T cell is a part of the immune system, part of the immune cells, and that T cell binds to the antigen presenting cells. And it produces two different types of T cells, the Th2 and the Th1. First one we're going to talk about is Th2. So, Th2 will bind to what we call as our B cells, is another immune cell. And those will bind, the Th2 will bind to the B cell, and this is actually kind of an abnormal response in the immune system because it will produce what we call as IgE, immunoglobulin E. And why it's kind of abnormal? Because what happens is it will bind to also our mast cells. And those mast cells, when the IgE binds to the mast cell, it will create that memory as an invader. That whatever that peanut or that pollen, any kind of allergies like that, when it's reintroduced again, that when we get presented by that peanut or that type of allergen that we have, it will bind. It will bind because remember the IgE has already bound to the mast cell here, okay? So it's already bound, but then when the antigen is reintroduced to the body, it binds to the IgE, and then the mast cell it will produce is what we call is histamine, and that causes an allergic response in the body, an inflammatory response in the body. And how that presents, it can present as hives over the body, anaphylaxis, hyperventilate, just basically allergic reactions that can be introduced. Also, you can be key inflammatory response in the gut. And that is considered a true allergy. Now, the other thing is what we call as IgG. And you might have done an IgG food sensitivity test. And that's what we call as a food intolerance test. Now, there's lots of theories behind this, but when we're looking at the body's immune system, again, the antigen is presented to the antigen presenting cell. The T cells are then bind to the antigen presenting cell and then produce what we call as Th1. Now, this is a normal immune response. The body is actually just trying to protect itself. And the Th1 will bind to B cells and produce IgG. Now, the body has as far as all the immune globulin cells, IgG is the most predominant. There's about 80 or 85% in the body. And what it does is it's protecting the body. So when food or certain types of allergens are kind of presented, it's just a protectant. And there's lots of theories whether it's not a true allergy, it's more what I call as a food intolerance in the body. But even still, if you've ever done an IgG blood test, even if you've consumed a lot of those different foods, like let's say before the test you were consuming a lot of milk, that test can still come back with high sensitivity of IgG. Doesn't mean you have the allergy per se. It could just mean that you just ate a lot of that food. It doesn't mean that you have that allergy. However, it is still some viable information because there's still not much understanding behind the IgG tests, but it can still present some viable information if there is a food intolerance. Now, what we here do at Nature's Health Clinic is we do both. We actually do the IgE test. We do a scratch test where you probably have done before, but we do foods and also environmental environmental allergies that could be possible that you might have. And we do that through a scratch test. Now, if you have some presenting environmental allergens such as dog, cat, molds, grass, or tree pollen, any of those kind of things, we actually use, we've set up a thing that we actually do desensitize those through a formula where we actually help desensitize by using the actual antigen itself. Now, as far as the foods with IgE, you usually have to avoid those. I usually say to avoid those within about a couple months if it is an IgE true food allergy. And then to actually really see if it's a true allergen is we reintroduce that food. We reintroduce the allergen to see if you still have a reaction or if there's a difference. Now, if you're doing the IgG test, same thing. Even though if you have foods that are presenting as a quote-unquote allergy or food intolerance, but I consider more of a food intolerance, that it could present as more maybe an intolerance, or maybe it's just because you've been just consuming a lot of that food. But what you can do when you get those results back is you do an also elimination diet where you avoid the IgG high markers of your foods, avoid it for about 3 weeks, 3 to 4 weeks, see if you have a difference with your health, and then reintroduce it and see if those allergens, or not allergens, but basically if you have gut issues again, or headaches, or sore joints, or even skin issues that are related. If you have those kind of presented, then that again will tell you that, okay, maybe I do have a food sensitivity or food intolerances when it comes to IgE, but IgE is where it's more the true allergen. So if you have any other questions, you can leave a comment in the section below. Also, if you're looking to actually get tested, we do that here at Nature's Health Clinic. If you want to be tested for allergies, you can just click on the link below of our website and set up an appointment. Thank you for watching, and see you next time on Docere, Doctor as Teacher.